Hi, good afternoon. This is going to be a quick tutorial on just focusing on the Pendleton rules for giving feedback. And I thought I'd just have one quick slide to just talk in terms of the sort of the theoretical framework in which we find Pendleton, which is very much a paradigm shift on how our feedback are traditionally giving. So if you look at some of these things on the right here, which we generally consider as negative ways of giving feedback and which generally does not encourage learning, these are actually very traditional methodology, sort of bad habits that we quite often find in medicine specifically. So public humiliation, the grand ward round where people are put on the spot, sometimes clinical supervisors that actually gives direct comments on personality, where there's not much two-ways discussion coming, but just one person giving feedback, where the person who's giving feedback has got very little personal interest in the person that they are actually giving the feedback to, and the feedback is too general and too little and too late. So what we want to focus on in giving constructive and effective feedback is feedback where you're in a relationship of mutual respect. If we give any praise or criticism, it has to be very specific so that somebody can know, okay, this is a thing I can do well, and this is something I need to improve. It needs to come from the right place. So we need to be in a space where we're really needing a desire to help. And allowing time doesn't necessarily mean you need a lot of time, but that you make sure that that bit of time that you are having to give feedback is actually protected. Very important, and we'll see that with Pendleton, is that when you are giving feedback, that there's great clarity about what the rules are around both the feedback and the thing that you are giving feedback on. So that's part of the culture of how we give feedback. And a learning contract really help us to be able to do that, to be very clear about what actually we are allowed to give feedback on. So if we look at when Pendleton is useful, so here you can see the 4 different types of WBAs you guys might be exposed to. So direct brief observations is when anybody is observing you, either doing a consultation or for example, doing a procedure, but also when you're, for example, doing a presentation in doing a CPD presentation on a topic, for example. These are all places where somebody's observed you doing something, and then usually after whatever you've done is ended, you now sit down and that clinical supervisor is going to give feedback. So this is something that you're not doing while the consultation, for example, is taking place. Longitudinal observations, you can also use Pendleton for that, and that will be sort of an end of block. So for example, you've had your 3 months or your 1 month in psychiatry or your 3 months in pediatrics, and now you meet with your clinical supervisor at the end, and Pendleton is potentially useful here as well, but we use some slightly more complex models. When somebody comes and discusses a case with you, so they walk up to you and say, listen, can I please ask you about this patient? This is when we use the 1-minute preceptor, which you've all been practicing. And then product evaluation is, for example, when you've done an assignment or where you've, for example, got some of your clinical notes when we're actually looking at something that you have produced. And then one can later sit down with you and also use Pendleton with feedback. But Pendleton mostly in our scenario is used when you have observed somebody in the workplace and you're giving them feedback afterwards. And I use this a lot for when my students give presentations. So what do we mean by Pendleton? So Pendleton has got a very specific structure. And when we talked earlier about creating a safe space and being very specific, Pendleton helps us to do that. So very important, and this is a good rule generally for all feedback, is that make sure you set the scene when you start your feedback. So you can't just suddenly catch people off guard. It's best to be in a scenario where if you're going to observe something, you say, listen, do you want me to come and observe you in this consultation? And I'm going to give you some feedback afterwards. And usually it's quite nice if people get to know the Pendleton and they sort of know what to expect. So the first thing you do is when you've sat down, you make sure you both understand what's going to happen. You've got a nice safe space. As you first ask the learner to actually give comments or background on what was done well. So I'm going to skip number 2 there. You don't necessarily always go into details in terms of what's been happening. So we're going to go to step number 3, and the learner is going to tell you what they felt went really well. And this is very important because sometimes we don't actually know what we're good at, and we can't actually tell the bits that we've actually completely mastered. And it's helpful if somebody says to you, okay, that particular thing you've mastered, excellent. At this point, depending on the conversation, you don't have to follow these strictly in order, but it's very good then to affirm what that learner has told you and to say, yes, I agree with you, I can see that. And usually then if you've got extra positive comments, you will actually build on what the learner has already told you and then add some of your own observations. The next thing then is you can ask the learner to start looking at what could be improved. Now, very important is that you're not going to tell the learner that they've done something wrong. So it's not about saying, oh, you did that incorrectly and you got that wrong and you missed that completely. It's all about looking at where gaps are that can still be improved. And that's the gesture of feedback. It's not focusing on an assessment where you're trying to see where somebody's deficit is. It's much more focusing on where somebody's learning needs are. So if you ask the learner if they identify, quite often they know where they're struggling or where they're not so sure about something or where something didn't go well. And then you can build on that. So you can say, okay, great. So this is how we can then perhaps take that further, or this is something I agree that you could potentially work on. And then out of that conversation, you're going to come up with an actual active action plan of how to make that particular improvement. These are very, very simple rules. So the strengths of these is that we really encourage our learners to actually reflect and being able to evaluate how they themselves are done. And it gives us a way in to have a conversation about things that need to be improved that doesn't feel quite like we're just nitpicking on various details, by first building a base of these things are working well and building on the concerns that the learner already have themselves. It's very important that we are giving as much emphasis on the strengths as we do on the weaknesses. And it's nice and specific. We're going to look at very particular things that we want to work on. There are some complaints. Some people find Pendleton can be very time consuming. I actually find it's more to do with practice. So what you want to be able to do is be quite efficient in terms of not trying to cover everything. There's sometimes a tendency that we want to go through all the details, sometimes just focus on 2 or 3 key things that you want to do. And what sometimes happens is that when you try and get people to talk about strengths, they sort of go straight into weaknesses. They'll go into no, I think I was okay with that, but, and it's a little bit how to create a rhythm of really creating space for those strengths. Some people find trying to stick to the principal rules might interfere with a conversation that might be wanting to go into a different direction. But again, the more confident you get with Pendleton, the more you can incorporate that into the conversation as it's happening. The idea with Pendleton is that it does protect the learner, but it's of course very much up to how you use it. And just artificially following the rules is not necessarily going to create safety unless you understand the underlying reasons of why you're doing that. So I'm going to run through a quick example. I'm trying to play 2 characters. I'm going to literally just run through the whole thing. So that you can sort of get a feel of what a little feedback session might sound like. So this was a scenario where a registrar had invited their supervisor in to come and observe them during a consultation where they were seeing a patient who had depression, and they'd done the consultation, diagnosed the depression, and had started the patient on an antidepressant. So this is now after the patient has left the room. Door is closed, and we're now going to do a feedback session. So thank you, B, for allowing me to be part of your consultation. I can see that you're making excellent progress on your journey. And just a reminder, so the purpose of this feedback session is to help you identify areas that you are confident on and the areas that you feel you need to also improve. It's not an assessment. It's not a critique. We really want to look at how we get you to the next level. So we're going to follow Pendleton's rules. And what I want to do first is I want you to reflect on what worked really well for you in this consultation. So where do you think your strengths are? Where was your, the bits that you felt you did really well? Thanks, Doc. Yeah, overall, I was very happy with that consultation. I'm feeling more confident now in screening and managing depression. And I think I was able to pick up some of her cues, like when she said she wasn't coping. So yeah, I think I was happy. I agree. I can see you've been using the PHQ-9 and you're getting confident with the diagnosis. Well done. And you were really able to build a nice, safe and supportive space for your patient. I like the open and respectful body language that you were using. So now I wanted to ask what parts you found challenging, or say you had a do-over and could do the consultation again. Is there any things you would want to change? What bits did you find tricky in this particular consultation? Yeah, Doc, I'm worried I might have been rushing a little bit. I don't know. And I was doing a lot of the talking, but I'm not sure I could have gotten her to engage more. She was very quiet, so that was a bit hard. It's true, you did talk quite a bit. Not all people have a need to share, so it's not necessarily a problem. But there are a couple of things you can do to engage your patient more. So in motivational interviewing, we talk about elicit, provide, elicit. So before you tell a patient anything, you just check in first on what they are thinking or what they are feeling. And after they've spoken and explained something to you or answered your question, then you do some active reflection. So you reflect back to them what they've said and you summarize what you've understood. And then quite often the patient is able to correct you if they feel that you're not quite on board. So let's make a plan. I agree, your clinical knowledge on depression and mental health is excellent. I'm very happy with all of that. What I think I'm going to do is I'll send you a couple of videos on motivational interviewing that can just help take some of your interviewing skills to the next level. And I want you to pick up one or two techniques that you can perhaps practice in future consultations. Is there anything you want to add to our action plan today? No, that sounds great. I was also thinking that I want to read up a bit more on the antidepressants they use in private. I realize I only know the public sector ones, and the patient mentioned some one she's used in the past, and I didn't actually know much about that. Excellent. I think that sounds like a plan. And why don't you fill in your WBA form for me now, and then you can send it to me so that I can fill in all this feedback and validate. So how was that feedback session for you? You all right? Yes, that was very helpful. Thank you, Doc. So in conclusion, that's very simply what Pendleton is. And the best way to get confident with Pendleton is just to practice it. And we look forward to seeing your videos of some of these in action. Thank you very much.